What is anxiety? Put simply, anxiety is a name for a feeling of intense dread, fear, and worry. Anxiety has physical symptoms too, like sweating, trouble breathing, muscle tension, problems digesting, and more. Anxiety is a normal part of life, and it can be surprising to hear that anxiety can be helpful at times. But when it's chronic, anxiety can be genuinely corrosive. Therapists like me help people overcome these conditions called anxiety disorders. Generalized anxiety disorders and phobias are among the most common, as is panic disorders, which cause panic attacks. What causes anxiety disorders? Most of us know what causes anxiety, but anxiety disorders are a slightly different story. We're not exactly sure what causes anxiety disorders. Risk factors include surviving trauma, especially childhood trauma, a combination of stressful life events, certain personality types, and even genetic links. Substance-induced anxiety disorder. Substance-induced anxiety disorder is a term for the anxiety caused by alcohol and drugs. Anxiety is common during drug use, but substance-induced anxiety disorder is more intense. Symptoms of substance-induced anxiety disorder include problems concentrating, intense feelings of fear and worry, restlessness, problems sleeping. I feel like I should point out that legal substances can cause substance-induced anxiety disorders too. And I'm not just talking about alcohol and cannabis either. Some over-the-counter medications can make a person feel anxious, as well as caffeine. Causes of substance-induced anxiety disorder. The main difference between anxiety and a substance-induced anxiety disorder is that the latter is caused by substance abuse. Many addictive substances can cause a person to feel intensely anxious. Meth is perhaps the best known example of this. Other drugs, especially synthetic drugs like K2 or spice, can cause severe anxiety as well. Alcohol can actually make anxiety worse over time. Finally, there's withdrawal. Withdrawal from all drugs can be extremely unpleasant due to the anxiety it produces. Some drugs, like benzodiazepines, can create a condition called rebound anxiety, where the symptoms they were prescribed for return once a person stops using these drugs. Substance-induced anxiety disorder is treatable. If your substance use is causing you to feel anxiety, that's a sign that your relationship with substances needs to change. Anxiety, whether it's caused by genetics or substance abuse, can be dangerous when untreated. Give the Edge Treatment Center a call at 844-590-0403 and we'll help you get started. Thanks again. See you next video.